Enggak. Enggak, Bagi. Wow, dan. Stop. Exactly.
Good morning, and good afternoon, and good evening, and welcome to the United Against Rabies Forum webinar on oral rabies vaccination in dogs. My name is Richard Chipman, and I'm a wildlife biologist and the coordinator for the U.S. Department of Agriculture's Wildlife Services National Rabies Management Program. Eliminating rabies in dogs is key to achieving our global goal of zero human deaths from dog-mediated rabies. Some disease models and real-world experience show the sustained vaccination coverage of 70% of dog populations is sufficient to prevent transmission between dogs and from dogs to humans. However, mass vaccination of dogs and maintaining herd immunity in dog populations using injectable vaccines can be challenging, particularly in research or settings with free-roaming dogs. A promising alternative for hard-to-reach dog populations is oral rabies vaccination. The targeted use of ORV for rabies control in dog populations was recognized as early as the late 1980s as a novel strategy that had the potential to significantly increase vaccination coverage in dogs, especially of free-roaming and poorly supervised dogs. While this method has been an essential component in the target elimination of rabies variants in regional wildlife populations, it remains an underutilized tool and is not currently integrated into practical rabies control strategies for dog-mediated rabies at the national level in any country. So today's webinar focuses on the presentation of the upcoming tripartite publication titled Oral Vaccination of Dogs Against Rabies, Recommendations for Field Application and Integration into Dog Rabies Control Programs, developed with the support from United Against Rabies. ORV is now an alternative, viable, and cost-effective vaccination approach. And this document will move us from the 2007 WHO recommendations document that called for additional research to this current document that shifts towards the focus, providing guidance for practical implementation of ORV as an integrated tool into the national strategies to control rabies in free-roaming dog populations. So fortunately, we have an excellent panel of subject matter experts with us today who will describe the new guidance document and answer questions to empower, engage, and to enable countries to save human lives from this preventable disease. An important reminder is that there's both chat and questions and answer options in this webinar. You can use the chat if you wish to introduce yourself to the rest of the audience. If you have any specific questions on oral rabies vaccination or to the speakers, please put those in the question and answer box. They'll be either be answered in writing by our experts and panelists or answered live toward the end of the panel discussion if there's time. So we'll be starting today's webinar with the presentation by Dr. Thomas Müller describing the ORV document, and then we'll move on to a panel discussion for the rest of the time. I want to introduce my good friend, Dr. Thomas Müller, who's a veterinarian with the Friedrich-Loeffler Institute, a federal research institute for animal health in Germany, and the lead for the law and the WHO reference laboratory for rabies. Dr. Müller, take it away.
Let me first, thank you very much for the nice introduction, Richard. I would like to, can you see my screen? Okay, yes. Within the next few minutes, I would like to present you the new recommendations for field application and integration of oral vaccination of dogs into dog rabies control programs. And before giving you an overview, let me start briefly by reminding you why we are here today. Rabies is a major public health problem, especially in low and middle income countries in Asia and Africa, where the burden of disease is highest. Rabies is fatal once symptoms appear, and the disease is supposed to cause one death every 9 minutes, resulting in an estimated 60,000 human rabies deaths annually worldwide. And sadly, 4 out of 10 human rabies deaths are in children below the age of 15. And we also all know that 99% of human rabies cases result from dog bites. And that makes it very clear that controlling rabies in dogs will prevent rabies in humans. So vaccinating dogs against rabies saves lives, but vaccinating just individual dogs is not enough. Only when the large proportion of the dog population in a given area is immune to rabies can the cycle of infection be broken, and therefore mass dog vaccination is key to herd immunity. Parenteral vaccination is the only approach used for addressing canine rabies at scale at the moment. So far, it has been quite successful. However, there are reports on increased inadequacies of this approach. And this is a table, taken from a publication of Wallace et al., showing examples from published literature of vaccination campaigns that have met or failed to meet vaccination targets. So you might ask what the problem is, why vaccination programs, as shown on the right, were unsuccessful in terms of vaccination coverage. And the answer is quite simple. It is the problem of free-roaming dogs. They are abundant everywhere, in Asia, Africa, Latin America, even in the southern parts of Europe, in the Mediterranean, and they can vary greatly in numbers. And these dogs are important in the transmission of the rabies virus and in the maintenance of the chain of infection. So the question is how to reach them best for vaccination. The use of the capture vaccinate release teams, as pictured here on the left, chasing after every dog is obviously not an option. Instead, an approach, as shown here on the right, where dogs are coming to the vaccinator in anticipation for food, would be a far more ideal solution. And this is where rabies or a rabies vaccination comes in, because it is considered a promising solution for vaccinating free-roaming dogs. And basically, it's like feeding dogs. You offer the dog a bait containing a liquid vaccine, and whilst chewing on it, the vaccine is released into the mouth cavity and is absorbed via the tonsils and the mucous membranes. Done. We have to admit that oral rabies vaccination of dogs actually is not a new idea. Quite some time ago, WHO, in collaboration with VOA, played an important role in promoting international collaboration and coordinating research. through informal groups of subject matter experts and international stakeholders. And during the past 35 years, a total of 13 international consultations and meetings on oral vaccination of dogs were held. But for reasons unknown, this idea was never really taken forward. And it was just with the implementation of the global strategic plan to end human death from dog-mediated rabies by 2030 that this idea gained momentum again, as these two publications nicely illustrate here on the right. So in fact, you know, the international rabies community was highlighting that all vaccination of dogs, including oral rabies vaccines, are actually well studied, but are a highly undervalued tool in the elimination of dog-mediated human rabies deaths. So even WHO and the VOA are now promoting oral rabies vaccines for free-roaming dogs. However, for successful implementation of oral rabies vaccination, guidance is needed. Also, the WHO issued recommendations in 2007. These are far outdated now, and therefore the United Against Rabies Forum set up an expert group to revise these recommendations and facilitate transition from experimental to field application of oral vaccination. And with the final goal to come up with a new joint tripartite document. And this is how the new recommendations looked like. And looking at the table of contents without going into details, you know, you can clearly see that this has become a very comprehensive document covering 5 important ORV relevant topics, of which I would like to highlight some aspects in the next few slides. The oral vaccination concept for dogs consists of 3 main pillars. Vaccines form the first pillar, followed by the bait system, and now, last but not least, the distribution system. They are all interconnected and depend on each other. And what you need to keep in mind is that the best vaccine is useless if the bait is not attractive to the dogs, while conversely, a good bait cannot compensate for an ineffective vaccine. And even if you have an ideal vaccine bait, you need to know how to best get it to the dogs. As for oral rabies vaccines, the document refers to international production guidelines as issued by the European Medicines Agency, the World Organization for Animal Health, and the United States Department of Agriculture. The document also underlines that oral rabies vaccines for dogs must meet minimum safety and efficacy requirements as laid down in the rabies chapter of the VOA terrestrial manual, as depicted here in that graph. Safety of oral rabies vaccines is of paramount importance, as you know, we are dealing with replication competent vaccines. So here in that document, we provide an overview on what animal and non-animal studies are required by both VOA and the European Medicines Agency to ensure that potential vaccine candidates are safe for target, non-target species, as well as humans. And these are extremely high hurdles for approval. For efficacy, orally vaccinated dogs need to be challenged 130 days post-vaccination with a field rabies virus strain, of which then 88% must survive a 90 days observation period, while at least 80% of the control animals must succumb to infection. And that it sounds quite easy, but first the minimum effective dose and an appropriate challenge dose must be established. And for the first time, and according to the scientific literature, there is an oral rabies vaccines for dogs available. That is the good news. The document also contains important information on bait specification and challenges, such as, you know, the different bait types, its palatability, for vaccine formulations, regulatory and other legal issues if it comes to the import of bait ingredients, distribution systems, the bait handling by the target species, and it also addresses the issue of locally made versus universal baits. We also provide, you know, detailed information on appropriate storage of oral rabies vaccines and, you know, its transport, you know, to the field. One focus of the documents is on the 3 different distribution systems, which is the handout and retrieve model, the distribution to dog owners, and the wildlife model. And we also provide a table highlighting the advantages and disadvantages of each of the 3 different distribution systems in terms of the target, meaning for reaching 70% vaccination coverage in the dog population, logistics, costs, and other issues. Documenting vaccination efforts, as you know, is critical for program monitoring and interpretation of campaign effectiveness. In any case, we strongly recommend that paper records should be strictly avoided, and free and easy to use mobile data and gathering platforms should be used instead. This is more important than serological monitoring of ORV campaigns, which for various reasons is not recommended. As far as regulatory affairs are concerned, you need to keep in mind that for the import of oral rabies vaccines, that the requirements can vary from country to country. It may also require different sets of documents or different governmental departments for approval and custom clearance, for example. So you better consult the competent national authorities prior to initiating the importation process to become familiar with the procedure and to avoid problems and unnecessary delays. And therefore, you know, the documents will provide guidance on the import of licensed oral rabies vaccines, but also guidance on the import of oral rabies vaccines for emergency as well as for experimental use. The document is also linked with 6 annexes, providing information on characteristics of commercially available oral rabies vaccines for potential use in dogs, as well as SOPs for oral rabies vaccination bait contact, you know, in humans. It will also, there is an annex on the lay vaccinator program, and one annex, you know, giving detailed information on e-health monitoring systems that are available for possible application in large-scale ORV programs in dogs. And last but not least, we have an annex on frequently asked questions, as you can see here in this slide. And with this slide, I would like to thank the members of my working group, in particular Richard Chipman, our moderator from USDA-APHIS in the United States, Konrad Freuling from the Friedrich-Loeffler Institute in Germany, Ryan Wallace from the CDC Atlanta, United States, and Ad Foss from Seva Santé Animale in France, and Rachel Chipman, the global rabies coordinator at the World Organization for Animal Health, for their hard work over the last 1.5 years. We would also like to thank independent reviewers, as listed here, for their valuable comments and suggestions which have contributed to the improvement of the document. And with this slide, I would like to thank you for your attention. It is our conviction that oral rabies vaccination can make a difference in vaccinating free-roaming dogs and be a game changer in the global fight against canine rabies. It just needs to be given a chance. Thank you.
Thank you, Dr. Müller, for that excellent presentation. And please keep your camera on as I introduce the other 3 panelists for today's webinar. And would all panelists please put on your camera so we can see you, and I'll introduce our first panelist. Is Dr. Beatrice Shikongo. She's a state veterinarian working as a field vet for the Directorate of Veterinary Services, Disease Control Division in the Zambezi region of Namibia. Welcome. And next we have Dr. Wahid Husein, and he's a veterinarian involved in the multi-sectoral cooperation of Indonesia on rabies prevention and control. He's worked for the Global Alliance for Rabies Control and is now working for the Emergency Center for Transboundary Animal Diseases under FAO. He has overseen the oral rabies vaccination field studies in Bali for the last 3 years. And finally, we have Dr. Ryan Wallace, who is a veterinary epidemiologist and lead for CDC's rabies epidemiology team. Dr. Wallace has spent the last decade implementing rabies control programs in canine rabies endemic countries, including participating in some of the first live vaccine field trials of gas Rabitech ORV for dogs. And with that, thank you for joining us today, panelists. We really appreciate it. And the first question that I'm going to ask is going to be directed to Dr. Shikongo. So oral rabies vaccine baits need to be stored at -20 degrees Celsius. And how did you manage this in Namibia, considering the remote areas to be treated and thus the long transportation lines and potential difficulties in local storage, where often there are no freezers available and maybe not even electricity? Can you share your thoughts on that?
Hello, everyone. This is Dr. Shikongo from Zambezi region in Namibia. Thank you for your good question. When we did the oral rabies vaccination, we had no challenges with the cold chain. First of all, we received the baits under frozen conditions by the logistic company. And then these baits were kept at the freezing cold storage at the local lodge where our international colleagues were based. Can you hear me? Okay. Yes. As an office, we had a limited capacity in terms of storage, so we had to, our colleagues arranged that the baits would be kept where they were based, and every day we would go to collect the baits on a daily basis, and these baits were thawed before we could put them in the cooling bags as we went into our daily activities. So during that time also we carried extra ice packs. As you know that Namibia is a hot country anyway. Yeah, so actually in a nutshell, we did not have a challenge with the cold chain. Yeah. Thank you.
Thank you. Would any other panelists like to add on about cold chain issues or logistics briefly before we go to the next question?
Just add, in Haiti, where the logistics are quite complicated, we also had no problem accessing cold chain storage in the urban and peri-urban centers. But we didn't try this in rural areas where it might be something that requires a little bit more thought. But even in some of the most challenging settings, cold chain's available. We partnered with the Ministry of Health. We partnered with a morgue You can get really creative in trying to find where there is safe and reliable cold chain storage within a country.
Thank you, Dr. Wallace. I think we'll move on. Oh, please go ahead.
Yeah, during our study in Bali, it's almost the same with what conducted in Namibia. So our immediate storage of the vaccine bed was conducted under 0 degrees Celsius. It's freezing. And on the day, the beds would be administered. The required bites were taken from the freezers and also placed in cool boxes with cold element. And at the end of the day, the remaining beds are returned to the refrigerator for the next day activities.
Excellent. And thank you, Dr. Husein. Actually, the next question is for you. So I'm going to ask a question regarding human safety. Could you discuss your thoughts on the human safety aspect of using oral rabies vaccine, considering all available oral rabies vaccine targeting dogs are based on replication-competent human pathogens? Could you give us your thoughts on that?
Yeah, sure. And the simple answer from me is to avoid both indirect and direct contact with the vaccine virus as much as possible. And the most important things in this context are the risk assessment for human safety and the likelihood of human contact with the vaccine virus. And in Bali, the handout and retrieve module was investigated, where the beds were offered directly to the dogs and countered, and any bed not accepted was retrieved by the vaccinators. And direct contact with the vaccine bed is almost completely excluded, although sometimes the owner offered the bed to the dogs. However, in indirect human contact with the vaccine virus cannot be excluded, as there is possibility that dog orally vaccinated will bite or lick someone in the hours following the bed consumption. And in Bali, we use a sachet that contain a blue dye that visibly stains the oral cavity for the same period to the persistence of viable vaccine virus in the oral cavity after the oral vaccination. And the survey we conducted in Bali found that around 6% of households providing beds to dog has direct contact with the dogs. But all 23 contacts were considered type 1 according to the WHO categorization for contacts with the rabies virus. And in my opinion, this highlights the low risk of human exposure to vaccine dose virus using the distribution system, and therefore only vaccine with the high safety profile should be used in the field activities. Thank you.
Excellent. Thank you, Dr. Husein. Would any panelists like to follow up on their observations on safety issues?
I'll just take the opportunity to throw a pitch to this ORV manual. I work for a public health institute, and I think one of the most important parts of this upcoming ORV manual is the human safety aspect. The products that we've all used are incredibly safe. There are numerous publications out there that demonstrate the safety, but that doesn't mean something less safe might try to come to market in the future. So everybody who's considering using this really needs to take a close look at the products they're considering, ideally with a regulatory body that is assisting. Consult the ORV manual. We provide awesome guidance on how to assess a product from the public health standpoint. But I think the exciting thing right now is that we do have at least one product that is very safe, very effective, and is now being used in the field.
Anybody else have comments regarding the safety aspect of ORV?
To be honest, we were also surprised that so many people had contact with their dog, but This could be a specific for Bali and does not have a general relevance. As you may know that most free roaming dogs in Bali are owned, and the owners are very fond of their dogs, and so contact is much more intensive than most likely in other Koreas, in other areas. That's my opinion.
Can you speak to a little bit more about the blue dye and how that was utilized to look at bait contact using the blue dye in terms of being able to document the potential contact with people after the dog was known to be vaccinated or known to have picked up a bait. I'm sorry, that question didn't come across very well. We'll loop back on that question, okay?
Rich, I can make a quick comment on marking from my experience.
Yeah, that'd be good.
When we did our field trial in Haiti, we didn't have any dye in the sachet. So we actually used a sprayer. At one point, we tried a super soaker, which they sort of work, but they'll get clogged. But we did trials in Bangladesh and the country of Georgia where we used a simple agricultural, a little sprayer you hold in your hand. It's got a little container with dye, non-toxic, and you can mark animals that have consumed the bait. Gets a little tricky when there's a lot of dogs, and some owners might not be happy when their dog comes home all sprayed pink, but it does help with some of the earlier implementations to understand which dogs are taking the bait and which aren't.
And we can move back on that some more too. I think it's part of the program monitoring that I think is important. But the next question is actually for you, Dr. Wallace. The price of the oral rabies vaccine date seems to be much higher than the parental vaccine dose. So what are your thoughts on the cost effectiveness of oral rabies vaccination campaigns targeting dogs?
Yeah, so I think when we talk about the cost to vaccinate a dog, you have to consider the whole cost. The vaccine is just one part. You have sensitization, you have your workforce, you have cold chain and logistics and vehicles. There's a lot of costs that go into operating a mass dog vaccination campaign. And a lot of studies have come out that relatively close to about $2 per dog vaccinated is what we're looking at when we do a high functioning large scale campaign, of which only about 30 to 50 cents is a parenteral vaccine. So that means about 3/4 of the cost to vaccinate a dog is coming from somewhere else. And a lot of the times it's your staff time. So if you're in a situation where your staff are having to run around with nets, spending 10 to 15 minutes capturing one dog while the rest run away because they don't want to be captured in a net, I think ORV provides a really good alternative because you will cut down on those staff costs. But alternatively, if you're in a situation where the vast majority of dogs can be brought to you, keep using parenteral vaccines. They are going to be lower cost, but they target a special type of dog, the dog that can be restrained and brought to you quite easily. Yeah, and also I do like the idea of ORV in the future. I think we're a little ways away from this, but almost like ORV tourism. I mean, those of us that have done this ORV baiting for free roaming dogs, it is fun. Like, I really doubt you'll need to pay vaccinators what we pay them now if they're going out and feeding dogs. It is a fun experience. So I think there's other avenues to even expand the idea of dog vaccination if ORV becomes a more prominent part of our approach.
Thank you, Dr. Wallace. I think panelists like to follow up on that with the question.
I think in Indonesia, especially in Bali, we may also have to look at the cost effectiveness of the prison program, as it's not been able to eliminate rabies yet from Bali Island. So I think we intend to conduct a cost effectiveness study comparing the present system with a program which incorporating the ORV. Yeah,
I think that's if I can jump in, that's a really good point, because cost effectiveness requires a timeline. You know, maybe for 1 year, it could look like parenteral only is really cost effective, but if it doesn't get rid of rabies and you have to do it for 20 years, it's not going to be a very cost effective approach, where maybe a more expensive 5-year effective campaign with ORV, you know, in the long term is going to look much more cost effective. But we have to realize large scale dog vaccination is not free. It is an expense that a government or an NGO or you know, an entity has to pay for. And we should be really conscious of what effective strategies are and how long it's going to take to get rid of this disease in the community.
Thank you. And we'll move on to a question for Dr. Müller. Given what we know about the available oral rabies vaccine, how often would you need to repeat these ORV campaigns targeting a given population of dogs? In other words, what would be sort of the coverage period when you start using oral vaccines?
Yes, thank you, Rich. Actually, that's a very good question. Actually, there's no difference between oral and parenteral vaccination. What you need to keep you need to keep up herd immunity. So the question is actually the turnover of the dog population, and therefore oral rabies vaccination as well as parenteral vaccination must be conducted recurrently in a given population until the rabies incidence is actually 0. And ideally, the population in a dog population in a given area should be vaccinated for at least up to 2 years after the last recorded case of rabies. And that's why rabies surveillance and monitoring of ORV campaigns is crucial.
Thank you. Does anybody want to talk a little bit about that as well from their experience? And this, one of the great things about this group of panelists is that they all have a little different experience when it comes to this. And I'm interested in targeted timelines. How long do you think it will take if we add and integrate ORV to our management strategy at a landscape scale? I think that's going to be the challenge. So I'm interested in your thoughts on timelines, getting enough dosages, whether injectable or ORV, to target at least 70% of the populations, because I think that's clearly still what we're looking at. Any thoughts?
Yeah, I think one part of the 70% value that's been kind of misstated for a very long time now is that 70% coverage is always applied to the free roaming dogs, and ORV targets free roaming dogs. So it's just my opinion here, but I think if we incorporate ORV more routinely for the vaccination of those free roaming dogs, I think elimination in certain communities is going to come much, much faster. But what I see a lot right now when I work with vaccine programs, when they use parenteral, the shots, is that a lot of their vaccine goes into dogs that never really leave the home. They always stay inside or behind a big fence. They're not really mixing. And it's great for that individual dog that it's vaccinated, but it's not contributing to herd immunity. And so I think a lot of campaigns that are showing high coverage but still have rabies, it's probably because they're targeting with parenteral vaccines the wrong dog population. And I bet with the inclusion of ORV into those campaigns, you will see massive declines in rabies relatively quickly. And then I just want to make one more point with the evaluation part. If you can mark dogs, that's great. But the end goal of vaccination is to see a decline in cases. And so it's important you have a good surveillance system in place and can actually document that after a campaign, cases go down. You should do that whether you're using parenteral or ORV. But with ORV, I think it would be even more critical, since we want to prove that this is a very sustainable and effective approach.
And if I can make a comment here as well, based on our experience in Namibia, and I think Beatrice can echo this, so our vaccination, is a nice opportunity to vaccinate more dogs as compared to parenteral vaccination, because you can vaccinate many more dogs in the same period of time as compared to parenteral vaccination. And this is what makes it so attractive. And this is also, a decisive factor for increasing herd immunity rapidly in a given area. I think this is, what needs to be highlighted, and this is what makes ORV a game changer.
Yes, if I may just come in shortly. It's true for us, oral rabies vaccination came at the right time, because previously we had not done mass dog vaccination during using the parenteral method, because most of our staff members were not vaccinated against rabies. So with this ORV, it was very easy for us to conduct instantly. We could even vaccinate aggressive dogs with minimum handling or no handling at all. Dog owners were also very happy to participate without fear of being bitten by their own dogs. So yeah, oral rabies vaccination, I would really recommend it, because in first time of our vaccination history, we had a higher coverage in 4 days, and it's very efficient. Yeah.
Thank you for that. Can you also speak, Dr. Shikongo, to the advantages that you see it both for the veterinary authorities, but also for the dog owners themselves? Can you talk about the advantages and perhaps any disadvantages you see of ORV? And that's directed to you, Beatrice.
May you just repeat that? I missed it. I think my sound system is.
I'll lean in and talk a little louder. So can you speak specifically to the advantages and disadvantages of using oral rabies vaccine for both governments and veterinary authorities, as well as dog owners? So I'm interested in your thoughts on both the positives and perhaps some of the challenges or negatives when you use ORV targeting dogs.
Thank you very much. Like I mentioned before we did the ORV, we had not done mass dog vaccination using the parental method, right? So for us, it came on the right time, because then we were getting a lot of positive cases of canine rabies and even in bovine. So because of our staffs not being vaccinated, we could not conduct mass dog vaccination. So with oral rabies, we could do it instantly. You understand? So the main advantage is that both veterinarians, the dog owners, they really liked the method, and it was a lot easier for us, and it was very fun for us to do. And maybe on the challenges that we faced is that I don't know whether it's a tradition in Zambezi. We had to move from village to village, household to household, because then they announced places that we thought our clients or the dog owners would come to have their dogs vaccinated. They were actually empty. So we had to move from household to household to have these dogs vaccinated. And like in many communal areas of Namibia, most dogs are owned, but they're free roaming. So when it comes to our normal routine of vaccinating dogs, we normally have to combine them with foot and mouth disease vaccination. And with this one, actually targeted specifically just dogs, regardless whether the owners are having cattle to go to the crash pen or not, dogs were vaccinated. Thank you.
Can I just do one follow-up? Yeah. So did you ever have a situation where the dog owners were unhappy about the approach, unhappy with ORV and denied access to the dogs? And that's for anybody to answer as well.
In our case, dog owners were very excited. To them, it was something new. And for some reason, they thought it was food for the dogs. So they were encouraging, their kids, bring all the dogs, which is very unlikely with the parental method, because they will just look at you like, these vets, what are they doing here? So there was no resistance, so to say. It was highly accepted. Both the owners and also the dogs accepted the bait. Some puppies would even catch from the bigger dogs. So there was nothing like a resistance.
Perfect. Thank you.
Yes.
Thank you. Thank you for those comments. Would anybody else like to comment on from their perspective? Was there any pushback from dog owners?
I've had similar experiences where the owners, once they knew what you were doing, were incredibly excited about it. From the owner's perspective, in a lot of these countries, you're walking your dog thousands of meters to a campaign, and a dog that's probably never been on a leash before. There's always bites when the people are standing in line, whether it's to them or to their dogs, at these parental campaigns. So I think the owners, in my experience, were incredibly excited about the opportunity to just have their dog fed, maybe in their own yard, while they do this. But it was really important that we communicated to the community why we were there. And we always come with flyers and handouts that explain what we're doing. Because in some of these communities, dogs are poisoned as a means of population management. And so you need to make sure you're really, really clear that it is, it's a vaccine, it's going to help the dogs, and why it's different than something that might harm the dogs, which most communities are unfortunately experienced with.
Yeah, I can also echo what has been said already, but in our experience, when we were out in the Zambezi region, sometimes the dog owners were even a little bit disappointed, when the dogs were not showing up, for vaccination. And they were running after our cars, and pleading us to give them some of the remaining baits so that they can feed the dogs themselves and vaccinate them. So this is just to illustrate, what an exciting method this is, for the dog owners. And they're actually really after it. Yeah, they like it. And yeah, you need to see it with your own eyes, and you see, the dog owner smiling and, being happy that for the first time in their life, their dogs have been vaccinated by such a clever approach.
Excellent. Thank you. I'm going to ask a question to Dr. Husein. And this goes back to sort of comparing methods and strategies for trying to target the dog population. What are your thoughts on how you could transition or maybe integrate a capture, vaccinate, release A-team approach, which is used widely, and the oral rabies vaccination teams? How can you bring those two teams together and integrate those programs?
Okay, thank you, Rich, for the question. To me, the CVR cannot be merged with the ORV, as both methods have the same target, free roaming dogs that cannot be vaccinated parenterally. And in my opinion, this combination might make vaccination activities ineffective. The ORV can simply replace the currently used CVR method for vaccinating free roaming dogs as complementary tool to increase the vaccination coverage. And to do this, the handout and retrieve module can easily be incorporated into existing mass dog parenteral vaccination campaigns. And I think there are two strategies to implement this model. The first one is, of course, all households should be visited and all dogs encountered and that can be handled. We can vaccinate using the parenteral method, and every dog encountered that cannot be handled by the vaccinator or by the owner can be offered an oral vaccine by the field officer. And the second model is, of course, after all dogs encountered and can be handled have been vaccinated using the parenteral one, they should be temporarily marked either by collar or paint marking. And we can conduct the ORV in the following day. So the ORV team can systematically search the area for unmarked dogs and offer these animals a bed vaccine. And I think this is the best way to incorporate the ORV into the mass dog vaccination campaign. And so sorry, related to your question on the advantage of the ORV, I think Bali also have conducted survey among the field officers, comparing the ORV and CVR, and the result indicated that they preferred ORV over the CVR, as the former is more suitable for vaccinating inaccessible dogs and less stressful for the teams and also the animals. And I think the ORV is more effective and efficient. And related to the owners in Indonesia, as some areas are still using dog culling with poison feed, the information campaign should be carefully conducted before the implementation of the ORV. Thank you.
Excellent. Would anybody else like to speak to that issue of sort of transitioning from one method and strategy to another, or integration of strategies and some of the advantages and, again, disadvantages, so that we're as transparent as possible?
I think every community tends to be a little bit different. They have different capacities in terms of veterinary experience. They have, and the types of dogs and the types of owners. So I don't think this will ever be a one-size-fits-all combined vaccination approach. I think it's just another tool in our toolbox, and some communities might use majority ORV if their dog population needs it, and some it might just be a top-up, a little supplement, you know, as you walk around the next day. I have seen a lot of really good questions pop up in the chat about the logistics of running an ORV campaign, you know, the marking, how do you find dogs, what if they eat more than one? They're great questions, but I'm telling you, these are very, very easy things to address in the field once you know where you're going to vaccinate. You know, like what was already said, a great strategy is do your central point, very inexpensive parental campaign first to mark those dogs, then come through with your ORV. You don't need to mark any dogs. You just vaccinate the ones, you give the bait to the ones that don't have their parental collar or mark on them, and it's incredibly simple.
Yeah, and just so the audience knows and the panelists knows, at the top of the hour, we're going to address some very specific questions that have been posted in the Q&A, and I'll make sure that we get to a number of those questions. And thank you for your comments, Dr. Wallace. That was spot on. I'd like to sort of follow up with that question for you, related to how we go about evaluating human safety of an oral rabies vaccine, because I think there's a lot of questions around that, and how would that look country to country, and are there some standards that we need to think about?
Yeah, so those are great questions. I think the biggest issue that we all need to understand is that oral vaccination is a method. Yeah. You don't evaluate the human safety necessarily of a method. We have to evaluate the human safety of a product. And so every new product that comes to market or you're considering using in your country needs to have a human safety assessment. There are several publications that suggest how these safety assessments should be conducted, and maybe our facilitators can put some of those in the Q&A or chat. But they're also covered in the ORV manual that will come out relatively soon. A lot of times this comes down to a regulatory body within your country or a regional regulatory body that, like the European Medicines Institute, Thomas knows it, it's not my region of the world, EMA. But, you know, these bodies provide, they're very reliable, they do very thorough reviews, and I think a lot of us need to start referring to the excellent publications and the, you know, these regional bodies that evaluate safety of a product, not a method, a product. And and that should provide a lot of assurance these products are good. But when you use it in your country, you need to be familiar with the safety profile. You need to have a plan for what you're going to do if someone becomes exposed. Anything you use should be incredibly safe. So no one here should be thinking of using something where if someone's exposed, there's a good chance they'll die. And the products we've all used, they're incredibly, incredibly safe. One paper that came out a couple of years ago did a safety assessment of one particular ORV product, and it found that we could vaccinate every dog in the world 3 years in a row at the risk of maybe one adverse event in a human. So, I mean, every time we do an intervention, there's a risk. Vaccinators are killed by dogs, and veterinarians are killed by dogs every year when they go and try to put their hands on an angry dog. ORV, it's a live virus. There's going to be some risk. We just need to make sure we are aware and comfortable with what that risk is.
So what we should keep actually in mind is, that as I pointed out in my presentation, that the hurdles, for getting, a vaccine license in terms of safety of the vaccines, they are pretty high. So this is to guarantee that there are, that only the vaccines with the highest safety profiles are being used in the field. And to add on this, the choice or the selection of the appropriate an appropriate distribution system, and here in particular the handout and retrieve model, is further reducing the risk that humans can come in contact with the vaccine. And just for comparison, in Europe, where oral rabies vaccines, attenuated rabies virus vaccines, were used for, oral vaccination of foxes, of wildlife, and have been randomly distributed by airplanes. We had, let's say, we have, during the past 40 years, distributed more than 1 billion oral rabies vaccine baits, and there was no human adverse events documented.
Excellent. All right, I think we'll move on in a few minutes. We're going to start asking some very specific questions that are coming from the audience today, and I'm very impressed with the amount of activity that's going on in the Q&A and the great questions. I have two quick technical questions. One for you, Dr. Müller. If when a bait's handed out and rejected, not accepted by an individual dog, can they use that vaccine bait again the next day? You're muted.
Sorry. That's an excellent question. Yeah, baits that were not accepted by a dog, can they be used again? In principle, yes, provided the bait has not been punctured, otherwise damaged, or let's say exposed to high temperatures or direct sunlight for too long. Because the latter, the high temperatures and the direct sunlight, are killing the vaccine, within, a very short period of time. So if this is not the case, the vaccine baits can be carefully washed with water before being offered to another dog. We have been doing that, quite a lot in, in the Zambezi region. And, the dogs, they don't distinguish, whether the bait has been, not accepted by a dog the day before. They just, go for it and chew it. And yes, clear answer, yes, you can reuse them.
Thank you. Perfect. I'd like to ask Dr. Shikongo if how did you solve the issue of vaccination certificates for orally vaccinated dogs during the field trials?
Thank you once again. During the project that we conducted last year, we had anticipated that we need to provide both the leaflets and the vaccination certificates. But as we went into the field, actually the certificates were not really requested upon by the dog owners. only a few requested because then they needed to travel. So they had to show that their dog was once vaccinated against rabies, which is mandatory in Namibia. So at the end of the campaign or at the end of the project, there were just few certificates, very fancy certificates. Thank you, Dr. Frank and the team. I don't know if you can see. We still have those in my office. So at the end of the day, we still have this, but we issued out reflex, which is very good for information sharing. Yeah.
Thank you. Okay, I think we're going to move on to the questions that are coming from our audience today, because I think there's some really good ones, and I'm not going to necessarily point to individual panel members on this. If you just speak up, then those who feel like they can answer the question. The first question is, can the virus strain used in producing ORV virus give effective immunity to dogs in sub-Saharan Africa?
There have been numerous, so yes, it's a really simple answer. Yes, the vaccine, and again, keep in mind, ORV is a method. You have to look at each product. So the products that we have all used in the field, they work on any dog with a competent immune system. Canis is a species. It doesn't matter if it's in sub-Saharan Africa or North America. They have the same type of immune system that's going to respond the same way to these vaccines. The only difference I would be concerned about is if you have an overly ill, weakened population, and then any vaccine will not work as well as it would in a healthier dog. But there should be no regionally specific concerns about the effectiveness of this vaccine as long as you're using it with the target species.
Yeah, I can confirm this. Immunization with modified live virus vaccines is supposed to provide a long-lasting rabies immunity, regardless, of the dogs, that are, existing, in different parts of the world. And this, immunity is superior to the protection actually induced by inactivated vaccines. And of course, as Ryan pointed out, this depends on the vaccine strain you are going to use, on the product, but we have evidence that in the animals still have detectable antibodies above the threshold of detection at least 30 months after a single dose, which actually indicates that, there is long-lasting immunity after the consumption of a single vaccine bait by a dog, if not a lifelong protection against rabies.
And to follow up, Dr. Müller, on that, is there a likelihood that additional boosters will be needed immediately after the first dose of ORV? Similar, like, what would be the expectation? An annual campaign to target these dogs, or every other year?
And as already pointed out, actually, we believe that a single vaccine bait will induce a long-lasting immunity in the individual dog. But again, it all your question is regarding the turnover of the dog population. What you need to take into consideration is, every year there will be a turnover. New dogs, unimmunized dogs will appear in the population, and these dogs need to be vaccinated as well. And that's why we have to have recurrent, let's say, ORV campaigns in a given population to keep the herd immunity up.
And I would just add, the bulk of the cost for a campaign is in your personnel and logistics to get to this community. We don't care if they were vaccinated last year and don't need it again. We don't care if they were given a 1-year or a 3-year vaccine. You show up, give every dog you see a vaccine. Your biggest cost was getting your people there, not the vaccine.
And there's also a question that is frequently asked is, does, oral vaccination interfere with parenteral vaccination? And the clear answer is no. We have, a recent data show that, let's say it doesn't matter whether a dog was first parenterally vaccinated and get a boost by an oral rabies vaccine or vice versa, so the good news is, there's a clear boostability, so there is no interference of these two approaches.
All right. Any other comments? All right. So it's sort of in that same vein, and I think that there are a lot of questions around this. Can the follow-up booster be parenteral form after initial dose of ORV and have the same results? Does that make sense?
Yeah, Thomas, I think you have the most recent experience with this one. Do you want to restate?
Sorry, can you repeat? I didn't hear that clearly.
Sorry, probably my microphone. I apologize for the microphone. Can the follow-up booster be in parenteral form after initial dose of ORV, or does it have to be ORV the whole way? Does that make sense?
So you mean the follow-up of the immune response? So I mean that can only be done in in immunogenicity studies, but not really in the field, because it will be hard, to capture, dogs that were already vaccinated, and that's why we do not recommend serological monitoring after mass dog oral vaccination campaigns, because they are heavily biased. You never know which dog you are going to capture for serological assessment, and that is a little bit of a problem. So, but based on let's say immunogenicity studies that have been published recently in local Namibian dogs and also local Thai dogs, we were following up the development of the immune response for a long period of time. And you can, that has been published, and it is quite clear from the data that, there is, while the binding rabies antibodies stay high, during a very long time post-vaccination, virus neutralizing antibodies, of course, as is to be expected, disappear after a certain period of time. But as soon as the animals get, a boost vaccination within a week, you can clearly see, that within a week, there is a huge increase in antibodies, both binding and neutralizing antibodies. So that is a clear sign that these animals have been, that the immune system has been, primed by the oral rabies vaccines, and is recognizing, let's say contact, with a foreign antigen, be it a vaccine or later in the field, and in contact with the field virus strain, the immune response is reacting immediately.
Excellent. Any follow-ups from any of your panel members? Okay, I'll follow with that, because again, there's a lot of questions around this, but has there been a formal comparison between injectable and ORV by way of cost, efficiency, and seroconversion? There been a side-by-side comparison anywhere that you guys are aware of?
There are numerous laboratory and field publications on this. Our program at CDC has done 3 or 4 of them, I think. Thomas, I know your group's done quite a few. We've got the Thailand ones, India. I think this is one issue for the rabies vaccination community, is that there are a lot of really, really good studies that have been done, especially around ORV. Please don't just repeat them for the heck of it. You know, reference the literature, talk to us. We're largely familiar with it. Review this manual that's coming out soon. A lot of them are cited there. But a lot of this information, a lot of this data, it's already been done. It's and we try to disseminate it through peer-reviewed publications and meetings like this. But I think at this point for me, there are very few unanswered questions for ORV for dogs. There's a lot of data out there. It's now up to manufacturers to get the right licensing and up to countries to start purchasing and using.
Goes to the safety question. Would it be necessary for anyone handling oral vaccine and oral vaccine dates to have pre-exposure prophylaxis prior to that?
So again, it's not, oral vaccination is a process. You need to think about your vaccine that you are using, and every vaccine will be different. They all are made differently. They have different risks that you need to be familiar with. But in general, no, there would be no broad recommendation for everyone handling a safe, effective, licensed vaccine. There'd be no reason for them to be pre-exposure vaccinated.
Yeah, so actually, touching an intact vaccine bait, is not considered, a human exposure.
And I would say the risk where I, as a public health official, would want someone pre-exposure vaccinated is in the handling of the dogs. And so if you're giving parenteral vaccination, I do tend to want the teams to be pre-exposure vaccinated, but that's not because of the vaccine. It's because they're going to get bit. We have a paper out of Haiti. I think it was like 5% of vaccinators get bit during a campaign every year. So pre-exposure is important for them. If you shift to a method where you never have to touch a dog and it's a safe, effective vaccine, there'd be even less reason to pre-exposure vaccinate your vaccinators.
Dr. Husein, can you address the issue of what vaccinators should do after a dog has consumed the bait? What should you tell owners of own dogs, and what should you tell the vaccinators team in terms of observation, in terms of handling that dog post-vaccination when you know an individual dog has consumed the vaccine bait?
I'm sorry, I can't catch your question.
Right, I'll ask you again. What are the next steps for the dog owner or the caretaker? Once you've observed the dog that has accepted and consumed the vaccine bait.
Well, due to the presence of the vaccine virus in the oral cavity after consumption, in my opinion, it's best if the owner or their family members avoid to or minimize contact with their dog for at least 4 to 6 hours until the vaccine is completely absorbed. And however, as a vaccine circulating in the field should meet safety standard from the WA and WHO. So I think the safety of oral vaccine should no longer be a matter of the discussion. And also there's nothing you have to do in particular other than be grateful that your dog is now protected from rabies because of the vaccination.
Great, thank you. Again, for the whole panel on this, is there a dose requirement in terms of the vaccine getting into the dog to achieve immunity? If the dog only eats half a bait, if you observe that they bit into the bait, but then they rejected it, what sort of guidance can we give the audience about that in terms of deciding whether that enough vaccine has gotten into the animal that we're targeting?
So I'll address it from one angle, but Thomas, if you can address maybe the WOA overdose studies, because they put way more vaccine virus into these baits than what a dog needs. But I'll let Thomas is an expert on that. I'll let him touch it. But I'll just say the point of oral vaccination is herd immunity. If we're going to move towards ORV, we're not necessarily considering the vaccination status of every single dog. It's now trying to get the free roaming population that couldn't be accessed by parenteral to have a high level of herd immunity. And so, you know, if some chew the bait and spit it out and don't get the whole dose, well, it's a lot better than nothing. But sure, it's going to be more effective if the whole dose is chewed into the oral cavity and gets to the tonsillar lymph nodes. But I think that's a different perspective we need to take when we move to ORV, is we're now really worried about herd immunity. As many free-roaming dogs as possible, ideally ingesting the full bait. But you know, that individual dog, if you're truly concerned and you can handle it, give it the 30-cent parenteral vaccine.
Yes, and as I tried to point it out in my presentation, if it comes to the efficacy requirements, you know, laid down by VORA, actually it becomes clear that you first need to establish your minimum effective dose, and all these efficacy studies have to be conducted using that minimum effective dose. Meaning that this is the dose that is guaranteeing, once, you know, the vaccine bait has been taken up by the dog, you know, is guaranteeing to elicit an immune response, you know, and that's why it's so important that vaccine producers need to establish that minimum effective dose. And what you also need to keep in mind is that actually these efficacy studies, you know, have been conducted, you know, by giving the dogs the oral, the ready-to-use oral rabies vaccine bait. It's not that you just can show efficacy of the vaccine by direct oral application. You need to give the bait to the dog, you know, and get them challenged and see if they're protected or not. And that also includes, you know, and, you know, the possibility that some of the dogs will totally consume the bait, but also some of them will just, you know, puncture, let's say, the blister containing the liquid vaccine, and only parts of the volume will be released into the cavity. So all these scenarios are reflected actually in the efficacy studies, and that's why they are so important.
On that note, is if approved by a government, how would one go about procuring the vaccines and the vaccine dates? Is it only through government health organizations, or obviously it's going to be different country to country, but what are sort of the standard responses for getting those kind of questions? And again, that's open to the panel.
That's a tough one because each country is different. You know, you shouldn't be importing a veterinary product, without working with your veterinary authorities in the country. But some that I've worked with, you know, they look at the regional approvals, they look at the licensure that exists in other countries, they review the safety profiles, and then usually the CVO will sign a document allowing the vaccine to be imported. But every country has a different process, which makes it really difficult for us to give one simple recommendation for how to move vaccine into your country.
Yes, we actually tried to cover this in the upcoming manual, as Ryan actually said, you know, so yeah, if it comes to regulatory affairs, it may even require different sets of documents depending on the country, different governmental departments, you know, that are responsible for approval and custom clearance. And so we can only give a general recommendation as regards the import of already licensed oral rabies vaccines or oral rabies vaccines for emergency use or experimental use. But in any case, you know, you need to consult the competent national authorities, you know, to get, you know, familiar with the process and to know what is needed. And I would say that actually it is the responsibility of the competent national authorities to import those vaccines. You know, it cannot be done via national or a non-governmental organization or something like that. They can be instrumental in the distribution of these vaccines, but as regards the import of commercial products, the responsibility lies definitely with the competent authorities.
And that's not unique to oral vaccines. Any veterinary product should be going through that process also. It's just this is new. So it's probably going to take a little bit more for governments to get familiar with the procurement process and the safety review. But everything Thomas just said should be happening for all your licensed parenteral vaccines as well.
That's excellent. And I think that's a pretty good way to call a close to our question and answer. But I do have one final one that I think is a relatively interesting one related to a team of vaccinators can cover how many free roaming dogs in a day. And this is more of a question that everybody that's on this panel that's actually done the work, I'm sure it's highly variable, but I'm interested in that, in the answer to that. So anybody.
I'll go first and set the standard here, since I do a lot of these studies and I love them. But so when you answer, panel, try to do it per dogs vaccinated per person. A lot of publications will come out and say, well, we vaccinated 100 dogs per team. But you got to look at the size of these teams. Some of these teams are 7 or 8 people. Some might be 1 person. So I really like to answer this question on dogs vaccinated per person. And in our studies with ORV, we can get anywhere between 60 and 100 dogs a day per vaccinator. On a CVR program, 10 to 15 dogs per vaccinator per day. Door to door and central point, it's really community dependent, but usually between 20 and 40 dogs per vaccinator per day. So in our experience, ORV is going to double or maybe even triple your efficiency of your vaccinators, and it's going to get the actual target population, your free roaming dogs. And so I think overall, if used the right way, it's an incredibly efficient system in communities that need this.
Yeah, and I hope, that Beatrice can confirm what I'm going to say is, based on our experience in Namibia, where parenteral vaccination in the Zambezi region has never been conducted before, we were using the oral vaccination of dogs. Within 1 day, I would say one vaccinator could vaccinate around about 200 250 dogs per day. And vaccinator, of course, I think that it was very impressive. How many dogs can be vaccinated by the oral route. And I think this is the most convincing argument, for implementing, this as a supplementary tool. Beatrice, do you want to comment on that?
Yes, Thomas. Yeah, we don't have good record with parenteral vaccination. The last time we did a good job was 2017 when we did mass dog vaccination. So from our combined vaccination of rabies and foot and mouth disease, they figure that a person vaccinated during the ORV is equivalent to the figure that we could get in 3 months. So yeah, there's a difference, a huge one. Thank you.
Dr. Husein, any comments before we close? Okay, well, I want to say, unfortunately, I think it's time to bring this webinar to a close. But I have to simply say, wow, and well done. And what a fantastic opportunity that it's been to have these cutting edge subject matter experts and true rabies warriors as panelists today. And my hat is really off to Dr. Müller, Dr. Shikongo, Dr. Husein, and Dr. Wallace for continuing to collaborate and freely share their knowledge and their expertise in that true One Health fashion to protect human and animal health through prevention and control of rabies in global dog populations. I also want to thank Dr. Conrad Huling and Dr. Ed Voss for working behind the scenes and answering questions in the Q&A. And I want to especially thank Dr. Rachel Tidman, the Global Rabies Coordinator of WOA, for being our fearless leader in terms of organizing and help put together this event. along with their colleagues, Dr. Katrin Boki, the technical officer with WHO, and Dr. Yu, who is an animal health officer with FAO. My three top takeaways from this webinar today are that oral rabies vaccine targeting free-ranging dogs can now effectively be integrated into mass vaccination campaigns to help us reach our global 0 by 30 goal. There are safe and effective ways to implement oral rabies vaccine campaigns targeting dogs, even in remote areas in terms of logistics and maintaining cold chain. There are multiple challenges, of course, but there are also cost-efficient strategies available to incorporate ORV into dog rabies management campaigns. And thankfully, there are a group of experts with knowledge, skills, and experience willing to assist countries with a diversity of rabies prevention and control opportunities and to help address challenges relative to a national strategy to control rabies in hard-to-reach dog populations. Finally, to formally close out the session, I want to thank you all for your participation and provide you with some final reminders. We encourage you to visit the frequently asked questions you'll find in the link again in the chat, and the recording of this webinar will be made available very soon. We'll also collect all the questions from this webinar and post the answers on the United Against Rabies website. If you didn't have a chance to answer your question today, you'll find it answered there in the coming weeks. If you have any additional questions or want to inquire about additional technical advice or support for your oral rabies vaccination programs, please email the Global Rabies Coordinator. You can see the contact email in the chat right now. Also, please keep an eye out on the United Against Rabies website and sign up for our newsletter to keep updated on the next webinar. And finally, the oral rabies vaccination document that we presented today is in the final stages of publication now, and it's anticipated to be published in June. And we'll announce this ongoing and we'll announce this online and through our social media channels very soon. So thank you all again. We have a final video to play in closing that shares some practical guidance on oral rabies vaccination, and we really look forward to seeing you next time. Thank you.
Thank you all.
This video will take you through the approach to vaccinating dogs against rabies using oral bait vaccines, and specifically on the bait distribution method itself. The approach to dropping baits for dogs to eat looks simple, but doing it in a way that maximises the chances of those baits actually getting eaten requires good technique and a basic understanding of dog behaviour. Here we're going to cover some key tips and things to avoid when performing the oral bait handout method. The baiting team consists of 2 people travelling by bike, a driver and a vaccinator/data collector. The team can carry both parenteral vaccines for dogs in the community that can be held for injection and oral vaccines to drop to dogs that can't be held. Here are some key things to keep in mind when dropping baits. Approach at an angle as if you're passing by the dog and avoid eye contact. Do not approach head on, as this can be threatening and the dog will likely move away before you get close enough to drop a bait. Toss the bait in an underarm throw so the dog can see it coming, and aim to land the bait gently about a metre in front of the dog within its line of sight, which hopes to trigger an inquisitive response. After dropping the bait, move some distance away to observe the dog as it consumes the bait, and record the details of the vaccination if you're using a vaccination recording app. And finally, collect the bait and any remnants of the sachet for disposal. Of course, vaccines can also be distributed on foot, and exactly the same principles apply. Here we can see that the vaccinator is walking casually past the dog and not directly at it, and the bait is gently tossed to land just in front of the dog, which is then interested to find out more. When a group of dogs are together, try to identify the dominant animal and drop a bait for this dog first some distance away from the others. Otherwise it's likely to chase off the other dogs and eat all the baits. We will now go through a few key things to avoid. Don't use an overarm throw, as dogs will likely think you are throwing something at them and so will move away and won't be interested to inspect the thrown object. Once you've dropped the bait, don't stand too close, as this may make the dog feel threatened and less likely to investigate the dropped item. Keep walking after you've dropped the bait and observe from a distance. Be careful not to surprise the dog, such as if they're resting or sleeping, as once startled, dogs are unlikely to return to examine the bait. And although oral vaccines are tested to ensure safety in wildlife species, try to avoid dropping baits where non-target species are likely to consume them. The key take-home points for vaccinating dogs by oral bait handout are to approach the dog as if casually passing by and avoid eye contact. Toss the bait in a gentle underarm throw and aim to land the bait just in front of the dog. Observe consumption from a distance and then return to collect bait remnants for disposal. This video has been created with the support of Mission Rabies, an international charity working to develop effective solutions to rabies control. For more information about their work and how to get in touch, click on the links below.